All right, well, welcome. It's episode 8 with Triangle Dentistry Talk. I'm your host, Dr. Carl Bernstein, and we are here today with North Carolina Tongue Tie Center, an orofacial myologist, Danielle Carey.
I'm doing well. How about yourself?
I'm doing great. It's the end of the day. We're getting all the rain from some hurricane, and hopefully that ends soon. But
Fingers crossed.
it's the end of the day, so that's always fun. Well, thank you for coming on the show. Thank you for giving us your time and wanting to explain to us, the community of Raleigh, Cary, the Triangle area, about North Carolina Tongue Tie Center, what you guys do, and how much benefit you provide to our community. So tell us a little bit about yourself.
Sure. So I've been a speech language pathologist for the last 12 years, and then became very interested in tethered oral tissues, tongue ties, and went down the rabbit hole of myofunctional therapy in about 2018. So I've been a certified orofacial myologist for a period of time. I work really closely with IOM and helping plan their convention, and then I have two little ones myself.
Well, that's great. And how long have you been at North Carolina Tongue Tie Center? And also tell us where it's located.
Yeah, absolutely. So I started with North Carolina Tongue Tie Center in May of this year. We're on High House Road in Cary, North Carolina. But before I actually started working at North Carolina Tongue Tie Center, I was referring to North Carolina Tongue Tie Center a lot, probably starting in 2020 all the way through when I started working there.
And then, when someone drives by, I believe, and correct me if I'm wrong, but it's located inside High House Pediatric Dentistry. So, but they probably both show up online on Google if you type it in, and you'll find it. But it's it's an awesome location in Cary, and also a really pretty neat inside building as well.
Yes, we were an old fast food restaurant. So when you go inside, you can see the blueprints from the old fast food restaurant and the new dental practice. It's
And
pretty
you can
cool.
see the drive-through, I think, as well, right?
There
Don't
is. There's
accidentally
still
go
a
through the
drive-through.
drive-through.
Don't forget your tongue exercises.
Exactly. Well, let's kind of dive in a little bit about what you guys do at NC Tongue Tie Center. So tell us kind of a little bit about how someone may get in touch with you, or why someone may look you up online.
Sure, absolutely. So North Carolina Tongue Tie Center is, I'm one piece of what they do. It's really focused on making sure we get functional releases and improvement of symptoms for all kids. Right now we're seeing babies through about age 15. And then if you wanted to get in contact with me, if you're having concerns about myofunctional disorders, speech therapy, or feeding therapy, you could either call our office. I'm going to go ahead and shout that number out, 919-267-4211. Or you can also shoot an email to our front desk, and we have slp@nctongueties.com.
So, I think a lot of people have heard of tongue ties. A lot of people maybe have had some tongue tie treatment, but I don't want to, talk as much as you, because you are, you know a lot more of this, and you're much more knowledgeable in this area. And so, but when will people and parents, and a lot of the times moms, will notice tongue ties really early on? So when's like the earliest someone may start noticing this tongue tie issue?
Sure. You may start noticing symptoms from a tongue tie pretty soon after birth. A lot of times especially when breastfeeding is the goal, it becomes pretty apparent because breastfeeding takes a lot of work of the tongue. We have a great IBCLC on staff to help with lactation as well at NC Tongue Tie Center. She's there for our integrative clinic that we offer on Fridays.
Awesome. And so, that's why I mentioned a lot of moms will notice first, because they're the ones breastfeeding, and they're the ones
Yep.
that are going to notice if there's any issues. So, you may notice it, and parents and moms may notice it pretty much like you said, right near birth, and while they're still maybe at the hospital there.
Yeah.
But let's kind of go and step back a little bit. But what are orofacial myofunctional disorders?
Sure. So orofacial myofunctional disorders happen when we have inappropriate rest posture. So we should have our tongue lightly suctioned on our entire palate. Our molars should be 2 to 3 millimeters apart, lips closed, breathing through the nose day and night. When we aren't able to do that, that could be because of prolonged sucking, thumb sucking, could be a tongue tie, could be enlarged tonsils or adenoids. So there's lots of things that contribute to an orofacial myofunctional disorder. But basically, if you have inappropriate rest posture, inappropriate swallow patterns, and inappropriate muscle patterns of the face, then we have a myo disorder.
And I would say to people listening, I mean, many times you may have, your primary care physician, your pediatric doctor may mention something to you, but you may just be able to look at your kid and notice something that, if it seems off to you, you always can give us a call, and especially North Carolina Tongue Tie Center, you can call them directly, correct? You don't have to
Yes.
have a referral to go in.
Yep.
So if you're even concerned, and or if you go to High House Pediatric Dentistry and you're already there, they're going to really be on top of it and provide you with that information right away. But I think it's not as difficult to maybe notice many things, but there are some things that you may not notice unless you have a professional provide you with some information and expertise. But like I said, we'll let Danielle provide some of that information. But what are some things that parents may notice that may give them pause and concern of wanting to come in or to call you guys?
Sure. So if your child is breathing more than 30% of the time through their mouth, that's considered severe. So that would be a red flag. So if you have that kiddo that day and night they're walking around mouth open, then we're going to have a really good indication that they might need some support. Things that you might not think about being related to myofunctional disorders include grinding. So excessive teeth grinding, sleep disordered breathing. You have a kid that maybe isn't getting restful sleep despite being in their bedroom that designated amount of time. They're not getting into a deep sleep. And then really picky eating is another one that's a red flag, but a lot of times parents will kind of write it off as they're being a typical kid, right? But I mean, the foods that we serve our children these days versus what we used to is very different, and it has a lot less of a myofunctional demand.
Now, some things that I've also have thought of, and you obviously hit on some of them, but I think not a good night's sleep, and I think a lot of people, what we expect as we're adults is we get really tired, and if we don't sleep well, we're tired. But kids sometimes become more hyper if they don't
Mm-hmm.
sleep. So touch up a little bit on that, and I think sometimes parents think maybe since their kid is hyper, they're not getting that lack of sleep, but it's kind of counterintuitive in that sense.
That's exactly right. It's almost like the opposite. They're hyperactive because they're overtired. And that's something that I noticed in my own son. We actually had a tonsillectomy, adenoidectomy, and nasal turbinate reduction. And that was the first time he ever breathed through his nose. And now he doesn't ever want to stop. And he sleeps so much better. And our sensory system just works so much better because we're getting that good REM sleep.
That's and I had a patient, and like I said, I'm an orthodontist here in Cary at my office in Bernstein Orthodontics, and we had a patient that came in that kind of very small petite girl, probably 6-7 years of age, but when she walked into the office, you could almost hear her breathing, and that was, you would look at her and not think anything of it, and you would think, one, did she just come in running, or was she out of breath, were they playing? But she was a mouth breather, and there was issues with the palate and being narrow and other things that we'll go over. But I think a lot of the times parents notice it and they catch on to it, because when we mention something, they say, yeah, I did see that, or I have noticed that. But I think it's more of becoming aware that that may not be as ideal or normal as they think, and need to come in and have a look at.
Right, absolutely. And doing an assessment never means that we're going to move forward with any kind of intervention. At the worst, if there's nothing wrong and it's just a weird kid, odyssey, then we'll be able to figure that out in the assessment.
Who is myofunctional therapy appropriate for?
Sure. So myofunctional therapy is appropriate for children that are 4 to 6 and up. So all the way through adults. I have adult clients, I have 4-year-olds, I have 6-year-olds. Beyond that, if they're younger than that and you're seeing some of these red flags, I'm not telling you don't do anything, but we want to, at that point, start coordinating referrals if we have concerns for sleep, or look at a pediatric feeding therapist.
And we're also not trying to scare you either. So sometimes, it could just be a bad week, maybe you do
Right.
get some bad allergies or something. We are in North
Right.
Carolina, but it's always good to be aware of things that are happening. And hopefully this will help make growth and development even better in the future, and improve function and really their life, as some don't think that there is that big of an issue. But the problem with kids, I would say, is it's funny, we think kids complain a lot, but they don't always speak up about the right thing.
Right. I've got a paper cut. but I can't breathe ever through my nose.
Right. So they don't mention some of the things because they think it's normal. And so, and again, it's not that it's abnormal or something wrong with anyone, but it's just something that we can maybe improve on. One thing I want to step back on, and you mentioned about adenoids and tonsils, and yeah, we do send and refer to ENT, and in a way they do make a final decision on that. But are there times, I know historically adenoids and tonsil remover kind of ebbs and flows, and sometimes they recommend it a lot, sometimes they kind of stay away from it. What are your thoughts in that sense, in the improvement for some kids, or why sometimes it's recommended, sometimes it's not, but they may get contradictory information from us?
Sure. So one thing I'm always looking for is who is the person that said yes or no, because I have spent a lot of time vetting different ENTs who specialize in airway. So if I'm sending someone and I'm suspecting enlarged tonsils and mouth breathing, I don't want someone to tell me, well, have they had strep throat 7 times in the last year? Because maybe they never have, but they also don't have room for them to be able to breathe easily overnight when they're laying down. So first, we're looking for a provider that is open to understanding airway. And then sometimes it's that there's a lesser invasive option. So sometimes something like Flonase, the ENT might recommend, and that's enough to clear up their sleep disordered breathing. And so we always just defer to the provider in that situation.
And I think that's, and Danielle keeps mentioning that just because you come in, it doesn't mean you're going to get a surgical treatment. It doesn't mean you're going to have appliances in the mouth, or obviously I'm an orthodontist, so I think of braces. You're not going to get braces just because you come in and talk to me about it. There are many things and many tools that can be used to treat anyone. And sometimes it's, in a way, therapy, related. It's exercises. It's not, or medicinal. It's not going to be always a surgical or an expensive treatment that's going to make you feel, kind of concerned in the sense of financial issues.
Right.
But I think there's a lot of options for people to use, and that's why Danielle is here. She's here to provide that information and to be able to provide that treatment as well. Does that sound about right?
That sounds absolutely right. And one of the reasons that I am with North Carolina Tongue Tie Center is because we base so much of our decision making on evidence and research. So just because we're called North Carolina Tongue Tie Center doesn't mean you're going to walk in and Dr. Ray is going to be like, okay. Yeah. He's going to be asking you the questions. Are you working with speech? Are you working with lactation? Or who are you working with to resolve this outside of just surgical intervention? And there's a lot of times when we are able to avoid any kind of surgical intervention and just exercises.
And that was one thing that Danielle had mentioned, which I did not, is that they are very evidence-based. None of this is trying to get you to do anything or trying to oversell you. The whole goal, and Danielle, as if you do have the opportunity to meet her in person, I mean, she's wonderful. I think you'll from immediate time that you meet her, I think you'll feel really comfortable and understand that she's really here to help and to make your life and your kids' life better. So she's not trying to oversell anything, but I think the evidence-based therapy is always a goal, and it makes it so much easier to speak with patients and parents and actually help them understand as well.
Right, because they're the leaders of the team and they get to make those calls. So our job is to present them, here are your options, here's our symptoms, we can try this, we can do this, what are you comfortable with, here's our risk benefit. I really love that.
And so with orofacial myofunctional disorders, or OMDs, we may abbreviate that as, how does that impact speech?
Whew, it is so impactful, and I hope, and one day, hope we will see every speech program in the country teaching at least a cursory level of myofunctional disorders, because it changes how you practice. When you're thinking about, as a speech therapist, where positions for certain sounds are, and then you take into consideration, well, this kid's anatomy, we have a high, narrow palate. How are we going to anchor the back of our tongue against these teeth for the R sound? So for speech, the sounds that are most frequently impacted are S, Z, sh, ch, L, R, TH sometimes, PB, M sometimes if there's a significant lip tie. But if you're having mainly those types of sounds, then that might be a little red flag of, oh, these are all sounds that are associated with myofunctional disorders.
And what would be like, what is treatment for that? What does that kind of entail? Obviously, you don't need to go full in depth and everything, but
Sure, yeah.
in the broad
It's
spectrum.
Yeah, it's a little bit different than articulation therapy. So instead of me drilling a sound that they're having trouble with and teaching them how to make that, I am actually teaching function of each of the muscles. So during the assessment, I test all 8 lingual muscles and I say, okay, well, we can't do this type of muscle movement. We can't do this type of muscle movement. And I pick actual exercises that target those muscles. I tone those muscles. And then at the end, I put those back into function. Now we can make this muscle pattern movement. Can we put that into function with the sound?
That's awesome. I mean, that we're so lucky in this area to have Danielle, because there's not many like her that are specialized. And what I think you said, what there's only four, there's not too many, right?
I think of the certified, there might be 5 to 7 in the States, maybe
Yes,
5
so we're
ish.
really lucky in this triangle area to have someone as special as Danielle, who also cares as much as she does. So I think that's also another important factor that I know I keep mentioning, but I think it's important to say, because she's dealing with kids. They're your precious ones, right? So we want you to be with someone who cares and who
Yeah.
actually is committed to getting that final result as well. So we talked about a little bit of impact on speech. How does it impact on feeding, or let's say eating as well?
Yep. So for feeding and eating, you're going to see a lot of different things. You may see messy eating. So that's your kiddo that's got their mouth open, they're smacking their lips to really move that food around. And what you're seeing is a deficit of their lingual and labial muscles. So they can't use their tongue and lips in the way that they're supposed to. They're open mouth chewing and smacking to move things around. There's also a lot of fine motor skill that's involved in eating. So when you're thinking about the mouth, the tongue the whole time is moving over to help keep that food on the occlusal surface here, while your cheek muscle is giving it the opposite pressure so that it
Mhm.
stays right where it should. When the one or the other is not functioning appropriately, the kids are going to have a hard time keeping the food just on their molars. So then you're going to get kiddos that maybe only like chicken nuggets and hot dogs and turkey versus
Sure.
like, steak and actual chicken breast and pork, if that's something that your family eats.
So what obviously a lot of what you're saying there, I understand as being an orthodontist, and affecting bite and occlusion and things of the positions of the cheeks and the tongue. How does OMD impact orthodontic retention? Because as you start to get older, but also how does that orthodontic treatment can sometimes improve some of the issues that people are having as well?
Yeah, absolutely. So, orthodontic retention, I would say, is really, really important for someone like you or any orthodontist, because if we have a kiddo and we get them in a good alignment, they've got a great bite, you take off your appliance and then things start shifting. And it's like, what the heck? Well, normally that happens when we don't have appropriate oral rest posture,
Mhm.
or if we have a continued tongue thrust, we're moving those teeth. So, it's really important that we clear up those functional deficits before removing the orthodontic appliance. And then controversially, one way that we avoid sometimes doing a frenectomy is by getting expansion first if they are someone that have a borderline posterior tie. Because what happens when we think about this high and narrow palate and then the tongue having to come up and be inside of it, if we are able to get this palate to drop and expand, the tongue doesn't actually have as far to reach and to get into the palate. So sometimes orthodontics first actually is the better fit for certain clients.
Now, let's say a patient, either we didn't see it, or they really wanted to get started because their teeth just looked really bad, and we understand that sometimes social pressure can be important as well for orthodontic
Absolutely.
treatment. Are they able to continue with myofunctional therapy during treatment with braces or Invisalign or whatever expanders, whatever that may be?
Absolutely. There are a few expanders that make some of the exercises more difficult, but generally, if we're looking at braces or clear aligners, there's nothing there that would prevent them from doing the full course of treatment. And then I've just modified some of the exercises that were impacted by those rapid expanders.
One thing I think that people may have a question of, and I have one as well, and thinking about is how long is therapy? How what would be, is there a normal average time frame when people, I bet you get that all the time, how long
Yep.
is this going to take? Is is, little Johnny going to be good in 6 months? So
Sure.
that's
I think,
everyone wants that the immediate solution and the
right.
answers. But, I know sometimes you don't have any at the time, and it takes time and it's a little unknown. But what do you see with your experience?
Sure. So I'm a little bit of an oddball, as sensory differences is one of my specialties as well. So sometimes if kids have significant sensory aversions, that can take me much longer. So we're going to take those as outliers and not have those factor in. Generally, I like to be through a whole program in 3 months.
Okay.
It's pretty quick. The younger the child, the longer it might take because I have to make it a bit more playful, but generally 3 months.
Well, that's awesome. I was wondering myself how long it would normally be, because I wasn't too certain. It's not something that I specialize in it by any means. And so I think that's great information to know that about 3 months, you'll see. Will you start seeing results even quicker than 3 months?
Oh, yes, absolutely. Because I start with lingual function, and I have some kiddos that are coming to me with like snoring and sleep disordered breathing as the primary concern. And those are the ones that tend to start seeing symptom resolution first. If there's no nasal obstruction, they'll be like, oh, wow, we've started these tongue exercises. And now all of a sudden, like most of the time, their lips are closed and they're breathing through their nose at night. It's wild.
Now, I think one thing that we now have more in today's time is social media and TikTok and Instagram and all that other social media that I'm maybe not as aware of. But it's, we see people do like taping, I think taping their lips. Is it the
Mm-hmm.
lips? And we see other little therapy that people promote on TikTok. And what is your thoughts on, at least let's say, the taping of teeth, or the lips together, not the teeth, but what does you see with some other TikTok things or social media therapies that people promote? Or
Sure.
are they really valid, or some beneficial, or are they used in the incorrect manner? What are your thoughts?
Sure. So taping, I have mixed feelings about, because in some cases it can be really, really great. And in other cases, we may be taping a kid's mouth shut that has, a deviated septum or enlarged nasal turbinates, and now we've taken away their way to
Well, the
breathe.
way,
So
yeah.
for me, that doesn't feel super comfy.
It's kind of the Wild
Actually,
West. You don't know
right?
exactly what's going to happen.
Right. So if I'm talking about children, I don't do any kind of taping unless they've had an ENT assessment and nasal patency is good. And then I don't tape across the lips. I actually get something called kinesio tape, and I follow the orbicularis oris muscle like a mustache here and then here. So what it does is when you pull that tension, it actually helps to pull that muscle into contraction. But if you need to talk or if you needed to open your mouth to breathe, you can still do so.
Any other things that you see on social media that you're sometimes like, I can't
Yeah.
recommend this, or I
The
can't
REM
believe.
plenish cup. Don't buy the REM plenish cup, please. It doesn't work, and it makes you use your muscles in the wrong way. So it's like a 70. I don't know if have you heard of it, Dr.
I have
Bernstein?
not. What is it again?
It's called the REM plenish cup. So it's like
Okay.
REM plenish,
It's like
and
sleep, I
for
guess.
sleep disordered
Okay.
breathing. So they have a kids version and they have an adult version, and basically you have a protocol of you drink this much water per day, and then your sleep disordered breathing is going to go away. I did try the REM plenish just to see, okay, what does it feel like? What muscles am I using? So before I switched to North Carolina Tongue Tie Center, I did, I think, a podcast and trialed it. It made me activate my masseter muscle way more. This is
Oh,
your biggest muscle for chewing. We don't normally activate it. Our teeth might touch when we swallow
right.
water, but otherwise it's not like popping like that. It made me activate this because you're actually biting on the straw. And it
Okay.
also put the straw between your teeth and on top of your tongue, which we are going to teach people. We don't want your
Don't
straw to
do.
go past your teeth or stop your tongue from going up and doing that wave. So I'm not a fan. 0 out of 10.
Yeah, I have not heard of it. See, that's why I wanted to ask you, because I had a feeling you've seen something. Because
Yep. There's lots of new products out there, and I always try to like test them out before I start recommending or trialing them with clients.
and I think that's one thing. There can be really good things out there, but there also could just be a person like me who knows nothing about it, but I'm a good salesperson, maybe. And
Right?
I'm
Yeah.
not personally, but if I was on TikTok, maybe I was, and that makes you sound really believable. And so I think things can sometimes, I think, become a detriment instead of a benefit with that. So thank you for at least sharing your thoughts on that.
Absolutely.
When it comes with the tongue tie center, anything that I did not ask you that you think that we should be aware of?
Um, well, I think we touched on a lot of it that we see babies, and we have Jessica Altamara, our IBCLC. Our integrative clinic, I don't think I described what that is.
No, go ahead.
So if you are a mother and you're struggling with breastfeeding, on a lot of Fridays, sometimes Saturdays, sometimes Thursdays, we'll have IBCLC, chiropractors, and Dr. Ray available. So we call that the integrative clinic. Your child will get an adjustment right before they go in for the frenectomy. They'll have the frenectomy with Ray, get an adjustment, and have latch assistance from Jessica. So I think that's a really cool and unique way that we help support these moms as they're going through a really tricky. It's not tricky. I don't want to say it's tricky, everyone. It's not. It's easy and it's not hard. But as a mother who has been through it when my son was 2 weeks old, it's emotionally a lot.
Mm-hmm. And yeah, I think, one, as Danielle is saying, never be embarrassed or nervous to ask, because if you don't know, what may be a lot more common than you think. And a lot more people are going through these same issues that you may be thinking are rare to you. But I promise you, it's the reason why we have the tongue tie center and why they have all those other opportunities there to help with patients is because it's needed. It's a lot of people experience these problems, and we're here. We're all here as a team to be able to get you through. Which kind of makes me think of one thing. I wanted to ask you is, like, what are the related professionals that might be on a myofunctional team? Because it's not just going to be one person. I think there's going to be a few doctors, a few therapists, a few specialists that are going to help achieve the end result. But go ahead, you would know best.
Sure. So on a myofunctional team, of course, the parent is going to be one of the head coaches. I'm going to be one of the head coaches. And then we're going to invite in ENT if we have any concerns for frequent ear infections, maybe enlarged adenoids or tonsils, nasal breathing. We have allergists if maybe I'm suspecting the reason we're not breathing through our nose is continued exposure to environmental allergies. We are going to have orthodontists who are going to help us get those occlusions in better, or the bites in better alignment, so that our kids have an easier time functioning. We may have pediatric dentists if they're the ones doing the releases. While I would like to say it's always North Carolina Tongue Tie Center, I know that there's a lot of other great providers in the Triangle as well. We may have sleep doctors. We may have functional medicine doctors, because there's a lot of holistic people who are very familiar with myofunctional therapy. OTs, if we have a kid with sensory differences or primitive reflexes that aren't integrated, that's going to impact their ability to go through the tongue tie release. So occupational therapists, physical therapists, because our babies that have tongue ties are at an increased risk for torticollis and plagiocephaly. So we've just got a whole slew of people that may be on this team. When we're talking about babies, of course, it's not myofunctional therapy, but we can also still help coordinate that.
Well, that's great. I mean, I think the big thing that Danielle said is they are able to help coordinate. They are able to get you to the right people, and themselves, are going to be able to help achieve that goal as well with the parents. I think parents being on board is probably number one. Would you say? We can't force. Yep. We can never force anyone to do anything, even if we think it's going to be a benefit. But we need the backing of parents, because their kids are going to trust them the most.
Yep.
And if you're already non-committed or think it's not going to work, or kind of a little scared, that kids can sense that fear of parents and can have a big detriment on some of the times the outcome of that treatment.
Absolutely.
Well, I think, we've had a wonderful time with Danielle. I don't want to cut it short. Is there anything else that you feel like we should be aware of? And obviously we're always happy to do another episode with you. It's really fun.
Yeah, I would love it. This is fun. I just think that if you have a concern, follow your parent gut, your mama gut, your daddy gut, your caregiver gut. I think every once in a while we'll see parents be dismissed for their concerns, and I don't ever want someone to not bring up a question or to not seek out another opinion because they were dismissed previously. Parents are the experts in their kids.
Yeah, I think that's perfect. And thing that I always forget is there are no stupid questions. There are no dumb questions. We say that to our kids all the time. So it's true to adults. It's true to everyone. You don't know what you don't know. So ask, and sometimes you may be teaching me, I may not think
Yeah.
about it either, or I may forget to completely ask about it. So ask, you're the one by your kids all the time. We see them for what, an hour maybe in that time of a month, or, a week, whatever it may be. So we're not going to know them as well as you are. So please let us know. And that's why I'm here as an orthodontist to help, but, we're here for Danielle today and what she does and the amazing treatment that she provides to our community. We're so lucky to have her. Any final words?
Check us out. Excited to
Yeah,
see you guys.
yeah. Say it again. So, what is the name of the office? Give us the phone number.
Sure.
Best way
Yeah,
to get in contact if there's an email. Um, Tell
absolutely.
us.
Yep. So we're North Carolina Tongue Tie Center. We're on High House Road in Cary, North Carolina. We're housed in the same building as High House Pediatric Dentistry. If you want to give us a call, our number is 919-267-4211. My direct email is slp@nctongueties.com. And you can also find our website, www.nctongueties.com.
Well, awesome. Well, it was a pleasure having you on. This was episode 8 with Triangle Dentistry Talk. I'm Dr. Carl Bernstein, and we were here with North Carolina Tongue Tie Center and the amazing, awesome, so sweet Danielle Carey. Have a good one.
Thank you.